I'm with Dr. Heather Rocheford, a board-certified plastic surgeon, and today we are talking about breast augmentation. Dr. Heather, thank you so much for joining us today.
Thank you.
So what is the difference between a breast augmentation and a breast lift?
A breast augmentation is for someone that wants to increase the volume of their breasts. A breast lift would be for someone that says, you know, I like the size of my breasts when they're in the bra, but when I take off the bra, then they droop down. So a breast lift is really for patients that have lost that firmness and the perkiness.
Okay, and that happens with just age, or?
You can lose perkiness, or you can get droop from age, pregnancy, breastfeeding.
Okay. Is that the medical term, droop?
Droop. Ptosis is the medical term. Ptosis, yes.
So who would be a good candidate for breast augmentation?
Breast augmentation candidates are patients that have either felt their breast size was too small their whole life, or if they've had breast loss of volume as a result of pregnancy and breastfeeding.
Okay, because they can get smaller.
Oh, they definitely. Majority of women experience loss of volume after pregnancy and breastfeeding.
Okay. So what are the steps someone should take before they decide to go through with a procedure?
Well, the first thing to do is to see a board-certified plastic surgeon regarding your options in terms of breast augmentation, and have a very candid discussion about your family history, your physical health. You need to be in good health, and then go over what the options are that you would like to consider: saline versus silicone, under the muscle, over the muscle. There's a whole variety of different options in terms of breast augmentation.
Okay, well, explain the difference then, because I want to touch on both of those: over the muscle, under the muscle, and the saline and silicone. So let's start with the saline and silicone.
The implants are both FDA approved. They're both very good implants. I use both in my practice.
Okay.
Probably about 50% saline, 50% silicone in my practice. The differences are cost. The saline implants are about half the price of the silicone implants. And the reason for that difference is that the silicone implants went through a very comprehensive research and study period for the last 10 years or 15 years or so. And so there's an increased cost as a result of all that research that was done to support their safety. And we know now that after exhaustive research that silicone implants are safe. That's why they're back on the market, and that's why the cost is higher. As far as the leak rate, both have the same leak rate. So there's a potential for leak with saline or silicone, which is 3%.
How does a leak happen? Is it too much activity, or is it just a malfunction in that particular implant? No,
the reason that leaks happen generally is because the implant folds on itself a little bit, and when it folds, it rubs, and where it rubs, it can leak. So generally, it's not a manufacturing flaw. It's usually just how it's sitting in the body. So it's nothing that the patient does wrong. It's nothing wrong with the implant. It's simply a happenstance of it folding and leaks as a result of that.
Okay. So now, over the muscle, under the muscle, what is the visual difference between that? Is one more rounded, one's more,
the visual difference really depends on a patient's anatomy. Most patients are thin on their upper chest. That's the reason they're pursuing breast augmentation. And so my preference is to put the implant underneath the muscle, just because that gives an additional layer of coverage and helps it look as natural as possible. In some patients with droop, when the breast is actually lower on the chest, if you think about where the pec muscle is on the chest, the pec muscle is up high. If you put the implant under the muscle, the implant's going to be high. But if the breast is drooping low, then you'll have an implant that's high and a breast that's low, which doesn't look aesthetically pleasing. And so in some patients, the better thing is to put it on top of the muscle where the breast is.
Right.
If they don't want to lift.
Right. Okay. Do you lose sensation and feeling?
There's about a 15% chance that you would lose nipple sensation. The majority of women do not, but there's no way to tell ahead of time who that's going to happen to.
Yeah, okay. So what's the average cost for a breast augmentation or a lift?
Breast augmentation average cost is $5,000 to $6,000, depending on what type of implants you choose. Breast lift is probably more the $7,000 range, just because it takes longer.
And does insurance ever cover something like that?
Insurance doesn't cover any cosmetic procedure, no.
No, not even, say, a woman who went through breast cancer.
Oh, if you have, if you're having a reconstruction as a result of a breast cancer, absolutely, that's federally mandated to be covered.
Okay.
So you would, so federal mandate actually is that if you have a breast removed for breast cancer, then a matching procedure on the opposite breast is covered.
Okay. What should a person look for in a plastic surgeon?
Well, you want to look for someone that's board certified in plastic surgery. There's a lot of different certifying boards, and so sometimes people are deceived because someone will call themselves a cosmetic surgeon, but they may be a dentist or so you need to really check that they're a board certified plastic surgeon, number one. And then probably the best thing to do is to first of all see the physician, make sure it's someone that you feel comfortable with, someone that has experience in the procedure that you're interested in. And so you can ask the doctor, you know, how often do you do this procedure? Is this your most common procedure? Those type of things. And then recommendations of friends or patients that have had it done. Most doctors will be able to give you patients that have had it done by them that are willing to speak to others.
Fabulous. So word of mouth.
Yeah, word of mouth, exactly.
Well, Dr. Rocheford, thank you so much for letting us join you today.
Thank you.
And we will be back.